Hello everyone, my name is Itunoluwa Onifade. I'm a developmental psychologist and I'm a substance use case manager working with A&D Referral Services Center. And you're welcome to our YouTube channel. And today we are going to be talking about how you can tell if someone you know is using drugs. Now, as it is expected that the effect of drugs vary from one person to another, even if they are using the same type of substance. And so sometimes it may not be easy to tell when someone is using drugs because the effect you see in person A may be different or a little bit different from what you see in person B. However, it is also important to know that sometimes behavioral change or mood change can actually serve as signals to you, although not always, because behavioral change sometimes could be that the person is actually having a personal problem in his life. But notwithstanding, you can still use behavioral change or change in mood to clarify your doubts about substances, and this behavioral change can serve as signals for you to raise a concern about the person's substance use behavior. So what are some of the signs you may need to look out for? The first sign is that you may need to look out for mood swing, sudden unexpected change of emotions. So when there is frequent mood swings in the person, that means you may need to be watchful for substance use. And then the third one is tiredness, when the person is just complaining that he's tired, or the person is just sleeping, oversleeping, tiredness, complaining about tiredness all the time. It's one of the signals for substance use. The third one is sudden emotional outburst, especially for someone that is kind of introverted in behavior. So sudden emotional outburst may actually be a clue for you to watch out for. The fourth one is minimal interaction with family members, friends, loved ones. Could also be so sometimes, most of the times, when some people use this substance, especially those that are called depressants, they tend to seclude themselves, isolate themselves from others, and then isolate themselves and spend most of the time alone with themselves. This is also a sign to watch out for, especially for parents. The fifth one is trouble with the police. If the person is having frequent trouble with the police, they arrest the person today, tomorrow, and all of that, then that means you need to watch out for signs of drug use. Another one is changing in eating patterns. Some people tend to overeat when they are using substances. Some people tend to their appetite tend to reduce when there are some drugs that actually increase your appetite. There are some drugs that reduces your appetite, so you need to watch out when there is change in eating patterns with the person. Then sudden changes of friends, when probably maybe you used to know them with some set of friends before and they suddenly change their friends. That means you need to watch out for substance use. Unexplained need for money or decline in school or work performance. Maybe they are always asking you for money and you know that this is unusual of this person to constantly be asking for money. Or when you discover that some things are missing in the house and it's very, very unusual, or they begin to be selling things in the house, that means you need to watch out for substance use and you need to raise a concern about it. Disappearing of money and valuables, just like I've explained the other time. When you see that valuables, they tell you today that my phone is lost, tomorrow my laptop is not working well, I've sold it, what kind of excuses, then you need to be watchful. Then affected memory, maybe the person is very brilliant and intelligent, you just discover that they are showing low concentration, low memory loss, or they easily forget things, then you need to also watch out. Then decrease in other activities that may have been important to the person previously, poor concentration and focus, and withdrawing socially. These are some of the signals you need to watch out to tell if someone is using drugs. And what is the next step? If you see some of these substances, you may need to talk to the person or bring the person to a drug rehabilitation center where you can clarify your doubts and go for drug testing. go for toxicology test. We do that at A&D Referral Services Center at 84 Ogunlana Drive, Surulere. Just call someone, get our contacts via our bio, and then you'll be able to be guided appropriately. I hope this video helps you. I hope this information helps you. Thank you for listening, and bye for now.